Good afternoon, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar series on insights from working from home during the COVID-19 pandemic. We would like to thank and acknowledge our health and safety system partners who support and collaborated with us on this series, specifically today from Public Services Health and Safety Association, Amanda Allen, Infrastructure Health and Safety Association, Peter Vai, Workplace Safety and Prevention Services, Don Patton, and Andrew Flanagan from Occupational Health Clinics for Ontario Workers. We are grateful to the Ministry of Labour, Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and the participants. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenters or a similar question should we have duplicate themes. Should you have a pressing question or issue such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for questions and answers with our presenters. The webinar will be recorded, with the recording being made available to you on our website, along with the presenters' slides shortly after today's webinar. After the webinar, you will be sent a link to an evaluation. Please fill out this evaluation as it will assist us in the future delivery of our webinars. Thank you so much for joining us today, and remember to watch the CRE-MSD website and the MSD Prevention Guidelines site for new resources and events. Now it is my pleasure to introduce to you our presenters, Dr. Susan Kotowski and Kermit Davis. Dr. Susan Kotowski is an associate professor at the University of Cincinnati. She serves as the Secretary-Treasurer for the Human Factors and Ergonomics Society. She is also active in the American Industrial Hygiene Society and the Ergonomics Committee. Her research is in the area of healthcare, particularly in relation to care provider, patient, and product interactions and intervention effectiveness. Recently, she has focused on office ergonomics and student learning. Dr. Kermit Davis is a professor at the University of Cincinnati, where he is the Graduate Program Director of the Environmental and Occupational Hygiene and Occupational Safety and Ergonomics programs. Dr. Davis is a past president and a fellow of the Human Factors and Ergonomics Society, as well as the American Industrial Hygiene Association. His research has concentrated on reducing ergonomic stressors of healthcare workers and patients in healthcare settings. In the last year, his research has focused on virtual offices. Now it's my pleasure to introduce you and hand this over to Dr. Susan Kotowski.
Hello and welcome, everybody. We are really glad you could join us and hope we can provide you with some insightful information about working remotely. All right, so when we look at working from home, what we know is that although there are millions and millions of people who go to work every day, in 2019, it was found that less than 4% of this population work from home on a consistent basis. But as we all know, at the beginning of COVID-19, that number increased significantly when millions of us were sent home to work remotely due to COVID-19. Many of us are still there or are in some sort of hybrid work format currently. And then what's been found, Global Workplace Analytics is predicting that over half of these virtual workers will actually continue to work from home for the next 2 years. When you look at the ability of people to actually work from home, it's about 50%. So although a large portion of the population has that ability, it's not traditionally been utilized. And in some occupations, those are such as in financial activities, information processing, and various business services, that the number of people who are actually able to work from home actually goes up to about 70%. So this is a population that we really need to pay attention to and set up to be most successful. So we know that working from home is likely here to stay for a much larger portion of the population than it previously has been. What do we know about working from home and that virtual work capability? It offers a lot more flexibility in terms of being able to be different places at different times, being able to do possibly multitask and so forth. If you look in the literature, you also see that there's improved job satisfaction when people work virtually and a reported improvement in work-family balance. And there's not a deficit in productivity. We actually see an improvement in productivity as well. However, there are a couple negative findings in that when people work from home, there's often limited resources to get them the office equipment that they really need. And another newer one that we're finding, particularly since COVID has come out, is that there's a potential for some burnout related to using web conferencing and virtual meetings. So the study we're going to talk about today was focused on faculty, staff, and administration at the University of Cincinnati in Ohio. And it was an online survey designed in REDCap, which is a HIPAA compliant software, where we wanted to assess people's current workstations. So this was rolled out in mid-April of 2020, a couple of weeks after we were all sent home due to COVID-19. So we asked them, we're going to go through what the survey looks like specifically. We asked them to complete a whole myriad of questions related to their workstation. And then we also gave them at the end of the survey an opportunity, if they wished, it was totally voluntary, to send in 2 pictures. So a picture from behind and from the side, so a lateral view of themselves in their workstation, and myself and Kermit would provide an ergonomic assessment of their workstation and what they could do to improve that workstation. So first, we'll start with the survey. It started with basic demographic information. So what was their position? Again, this one solely focused on faculty, staff, and administration. We did also do a survey for students that we're not reporting here. So faculty, staff, and administration only in these results. The age group, we asked them in 10-year increments to provide which group they were in, and then their gender. We also asked some general questions relating to approximately what % of their time at that point they were working from home, and some other questions related to what equipment, if any, had they brought home from their office and what it was specifically. Our university adopted a policy at that point where it was up to each college and each department as to whether or not they were allowed to do so. So we wanted to capture who took advantage of that opportunity and what pieces of equipment they were bringing home. Then there was a whole grouping of questions related to their workstation. So these were some of the questions we asked them. When working in your home office, how often do you use different types of computers? And all of these questions were never, seldom, sometimes, often, and always. So these included a laptop, a desktop, a tablet, and then other types of computing devices. When they were working at home, how often did they use various types of seatings? And we had all different options there in terms of an office chair with adjustable arms, without adjustable arms, a dining chair, a folding chair, some other type of stable chair with or without arms, or another type of surface like a couch, a bed, or something like that. If they indicated that they had a chair with arms on it, there was an additional question that popped up, which was, are the armrests on your chair adjustable, which was simply just a yes/no response. Then we also asked if the chair that they were using had lumbar support. So it was yes, built-in lumbar support. Yes, they had made one of their own using something like a rolled up towel or a small pillow, or no, it did not, or I'm not sure what lumbar support is. When looking at when they were in their home office, what types of screens do they use? So again, asking them on a scale of always, often, seldom, never, and so forth. It was looking at whether they use their built-in computer screen on their laptop, whether they use a standalone screen, 1, 2, or more, or a combination of their built-in laptop screen and one additional monitor. So they had several different options to choose from there. And then input devices related to whether they used a built-in touchpad, an external mouse, a stylus, a keyboard, or which combination, and again, how frequently they use those different types of input devices. Then we asked about what different type of workstation they were using. So a traditional desk that they already had in their house, a makeshift desk created from a kitchen table or some other situation like that, whether they used a store-bought sit-to-stand table or a sit-to-stand table that they had created themselves out of some sort of platform, maybe with a stack of books or boxes, and again, in what combination of time they utilize those different workstations. And we delved a little bit more into specifics about posture and what was going on when they were in a sitting position. So specifically when they were sitting, we wanted to get an idea if their back was in contact with the back of a chair to assess whether they were utilizing that back support. And then about body posture. So if they at any point in time were twisted or bent sideways, again, looking at never, seldom, sometimes, often, or always. And then similar questions for their neck, whether they had forward flexion or backwards flexion. So we asked these separately to assess, to get an idea if some of their other equipment was potentially too low or too high. And then asking if they had neck twist or lateral bending. Then when they were looking at their screen, again, head and neck posture, was it mostly neutral? Was it tilted forward, backwards, twisted, or bent sideways? And then one additional question about glare from their lights in their room or also off of their screen. Then there was a grouping of general questions related to their work. So asking about how long do they work without taking a break? We asked this in 30-minute increments. So 30 minutes or less, 30 to 60 minutes, 60 to 90, 90 to 120, or 120 minutes or more. If they wore glasses or not, this was a no, I don't wear glasses. Yes, I wear bifocals, or yes, I wear non-bifocals. So again, trying to look at different factors that could, influence their work comfort throughout the day. Then asking how often they had some sort of physical activity in terms of walking 5 or more minutes during the day. So again, getting up and being active. So 1 to 2, 3 to 4, 5 to 6, 7, 8, or 8 or more times a day. We also wanted to get a couple of questions in, even though we were just a few weeks into working from home, we wanted to try and assess whether or not they were already experiencing stress and at what level compared to working in their normal office. So whether it was about the same, whether it was less, slightly more, or significantly more relative to working at their traditional office. And then we also wanted to assess how tired they were. So in addition to having to make a significant workplace shift, a lot of classes were having to be shifted to a totally online format and so forth. So we wanted to get that measure at this point in time too. And then lastly, we wanted to look at any current physical discomfort as compared to when they looked in their normal office. So we did this through a multi-body region assessment and a Likert scale. So this is what that discomfort question looked like more specifically. So we asked them on a 0 to 10 scale, 0 being no discomfort, 5 being moderate discomfort, and then 10 being extreme discomfort. What was the current level of discomfort in the following regions? So it was very easy for them just to go through and rate these quickly. We were actually able to not only get a baseline survey that went out in spring of 2020, in fall of 2021, we were actually able to get a follow-up survey. So we had 843 participants in spring of 2020 that completed the survey, and you can see the breakdown. It was by far the majority of participants were faculty, then staff, and a small number of administration. When we went back in fall of 2020 and we repeated the survey, we had over 1,000 participants complete the survey this time. A much more balanced response in terms of faculty and staff, and an increased rate of participation from administration, but still not very many. Now, one question or one item to note is that the university didn't allow us to do any tracking on this survey. It had to be totally anonymous. So we were not able to link participants who participated in spring with those who participated in the fall directly for direct comparison. But we did on the fall follow-up survey ask if they had participated in the spring survey. So we do have the potential to look at the data between those two groups. Now I'm going to turn it over to Kermit to talk about the survey results.
So one of the things that we found right away was that people were sent home with laptops, and this did not change in the follow-up in the fall. So after we've been into home, working from home for many months, over 6 months, 7, 8 months worth of being sent home, people were still working on their laptops. That was the number one used device, and it was overwhelming. Almost 70–80% of the people were able to use laptops. Next. What also you see is that non-traditional desks. Traditional desks were used, somewhat frequent, 30% of the time, but overall, makeshift desks or makeshift sit-stand desks, or not even a work surface at all, were being used. So what we saw and what we'll see later is, many people going and using their laptops on couches or desks. Can you hear me now? Better?
I can hear you.
Okay. I hope everybody else can. I'm not sure why it changed. We were all tested earlier and it's perfect. So what you see is as many people were using non-traditional desks. They didn't have them set up. They're oftentimes at kitchen tables or at the countertops at the kitchen, or on couches or seats in their living spaces. Next. Also what we find that a few people, or relatively few people, were actually using office chairs with arms, particularly arms with adjustment. The ones that were using office chairs oftentimes did not have any arms. And then again, as I was alluding to before, the workstations were conducive to using dining room chairs, couches, armchairs that are, not necessarily meant for office work. And also, as when you were sent home with laptops, most everyone used a laptop keyboard and a laptop mouse or input device, either a trackball or some type of input device with the laptops. That was mostly what was being used. And so what we'll talk about later is alternative to this would be, traditional mouse and external keyboard to the system. But most people were basically sent home with a laptop, and that's what they used. Go ahead. Then if you look at the discomfort, you get high levels of discomfort where you see moderate to severe in many individuals in the upper back, shoulders, in the neck area, as well as the mid back and lower back. And you didn't see any impact when we went to look at the fall. So if you're looking at the results, it went from spring having high levels of discomfort to fall having high levels of discomfort. And this is kind of what is kind of perplexing when we're moving forward to having a long-term usage of working from home. Next. As you can also see, a lot of people did not use any type of lumbar support. Very few had 70% in both. Even working in the office, it oftentimes you didn't have lumbar support or adequate one. And this is something, again, troubling of people that are working from home. Next. So we did some summaries of regression here, where we built various regression models to look at what was impacting the discomfort. And the ones in green are beneficial, and the ones in red are detrimental. And some of the key factors that come across as you look across all these different models is glare is a major problem at home. Partly this is many buildings at work are treated in a way that that don't produce the glare that you have at home. Oftentimes you're at home, you are working in an environment that doesn't have, that are working, sort of perpendicular to windows, oftentimes, or even you're back to the windows that can cause a tremendous amount of glare. So glare is a major issue. You also see things like couch workstations, sharp edges on the front of the desk causing issues. External keyboard was one. But you also can see other areas where, that can benefit. Obviously, using an external monitor with laptop, having your back in contact with your chair, sit-stand workstations can have some benefits. If you go to the next one, we can look at those also. Again, with these body regions, you still have glare as a major factor. You see benefits of back with contact, in contact with the chair is a major thing, and then time without a break is also a key component. So you need to have breaks that will allow you to move around, is very beneficial. So again, there's key areas that came up as being protective and being a major issue, especially glare at home. And I think that's. So if you take a look at the take-home message of the surveys, the laptops are widely used, and they continue to be widely used. Many people used kitchen tables and counters as their favorite place to work, and we'll talk about why some of this is an issue. And certainly discomfort was significant in many body regions, both in the spring and follow up in the fall. And this is perplexing, I think, moving forward, because many people are continuing to work at home, and need to have various components that we're going to talk about to address, and make things better at home as they would be in the office. I'll turn it back over to Susan.
Okay, so as I mentioned early on, in addition to the survey, we offered participants the opportunity to submit 2 pictures of themselves to myself and Kermit. And again, those were directly from the back and then a lateral view. And we asked them to have somebody else take the pictures so that we could see them working in their workspace. So see postures and relation of their body position to their workstation and the different workstation components. So we had a small portion of those individuals who did the survey opt to take advantage of this opportunity. So we went through and identified what ergonomic concerns we have, which is what I'm going to go through. And then we provided them a document of what we saw and what suggestions we would have in how to correct that, item that we saw. And we tried to give them a range of opportunities in terms of from purchasing something to utilizing something that they had at home. So they had different options. So for instance, lots of people or many people that we received pictures from had dual monitors, and there were lots of concerns, as you can see in some of these pictures, in terms of positioning, not only where they are directly in front of them, but a lot of them had to do with varying heights. You'll see a lot of people utilizing a laptop. So you have that connected screen, which means it's going to stay really low on the work surface compared to an external monitor, which is going to be much higher. So we had several recommendations of either utilizing the laptop screen and elevating it, using a stack of books or a box or something like that, and then utilizing an external keyboard and a mouse, or utilizing a secondary external monitor while utilizing the laptop keyboard and mouse. So a number of different concerns there. Again, you can see height issues, postures where they're having to look considerably to one side and so forth. And then some where they did have things more aligned and so forth, but maybe slight adjustments needed in height or location. Another really common one, again, we saw just about everything under the sun in terms of where and how people were working, not to be unexpected when you literally almost have to walk out the door with what you can have and go start working from home. But so workstations where they're working on more traditional furniture, which has hard edges on it, lots of table surfaces, counter edges, and so forth. And you can see where there's potential for some compression on the wrist and so forth. That was definitely of concern. And then seating concerns, again, in the top left picture, a more traditional dining chair where it's not well supported in the back. It doesn't have arms on the seat. Nothing is adjustable other than, scooting themselves in and out. The middle picture where, they have a chair, it has some cushioning, it has a back on it, it has arms which are unadjustable, but the major area concern here where they are not, it's not fit well, and it could be for any number of reasons, but they're sitting so far forward that they're not utilizing any of that support from the chair back or the armrest at all. And then in the bottom picture, a really fun, stylish chair. And this individual is sitting back in the chair, so they are getting that back support, but no support of the arms. And then you see that really clean line desk there that has a really sharp edge on it. So offering some suggestions, again, of various chairs they might consider or other types of chairs they might look for in their home that might be better suited. Some opportunities if they can't raise the chair itself, sitting on pillows. If surfaces are really hard, doing things like taping a rolled up towel along the edge, something like a sliced pool noodle or a piece of pipe insulation to provide a cushion there without contact to reduce that contact stress, and so forth. Lots of monitors being too low, and again, the common theme here is you see a lot of laptops being used. And for the individual in the top left, again, they made a concerted effort to raise their workstation, but a number of different issues there. Still utilizing a laptop, so you can see she has to look down pretty significantly in order to look at that screen. And she has no arm support of any kind there and a very tiny work surface. So again, an attempt to utilize, she actually had a sitting workstation too. So an attempt to move between two types of workstations, but needed some help on suggestions of how to make that standing workstation better. Again, in the bottom left, you see another laptop being used. So that very commonly observed low screen and lots of forward neck flexion. In addition to a lot of these pictures, we could use in multiple categories: a glass top table, so an edge with a potential to put a lot of pressure on the wrist there. Middle picture, same thing, laptop, so again, significant neck flexion. And then that bottom right picture, you actually see 4 different screens going there: a tablet, a laptop, and then 2 other external monitors. So not only height issues there, but also then depth issues, as some of them are closer to him and some of them are farther away. And we have a much bigger difference in the size of the monitors as well. And then you can see on his as well, he's even got it overlapping. He does have a keyboard tray, but his hands are underneath his laptop. He's on looks like a more traditional wooden chair without any kind of arm support and so forth. So many different issues across the board here. Non-traditional workstations were fairly common as well. Some people, depending on where they were, did not have any kind of designated office space, which meant they are working on their couch routinely, as you can see on the left. Now, they did try and put a work surface, a more solid work surface underneath the laptop to get a platform for their mouse and so forth. So offering suggestions of ways they might create a temporary work surface that is going to be better than this. The middle one, she's actually working in her bed. This was a situation, again, common too, and some of this was there were other people in the house that were also sharing work surfaces. So while there might have been an opportunity to have a more traditional work surface to utilize, it had to be shared. So sometimes you were trying to find other places to work. So laptop simply on her lap in bed, which is by no means ideal. Then you see on the right, this was a person who does a lot with music. So she's actually, it's kind of a little bit difficult to see. She actually has a keyboard, like a piano keyboard, across her lap that is then tied into her computer system. So she's trying to utilize that on her lap. And you can see she has a pretty decent office chair that looks like it has some good lumbar support and, you know, back support in general. And it looks like it has some adjustability to the arms, but because she needs to hold that piano keyboard in her lap, she's not utilizing either of those features. And then in addition, she's having to reach up to utilize her mouse and keyboard and then her monitor. And you see some pretty significant issues with light coming in directly behind that as well. We did see some people who had designed some alternative workstations. Again, several different attempts at creating a sit to stand workstation, whether that be 2 independent surfaces. So they were working on a more traditional kind of table as their sitting workstation and then utilizing another surface, whether it be something like this where was on the same surface and they raised it up, or going to a totally different surface, like from a kitchen table to a kitchen counter, that would be higher as a change in pace to go back and forth from sitting to standing. So again, some attempts at this, but the opportunity, for us to offer some additional improvements there. So the lady on the left, you see, she actually tried to do a fairly good attempt here. She had a standing mat with that. She elevated her keyboard on a stack of books. It's kind of hard to see, but she had another stack of books with her mouse on it, and then did get her monitor up to a decent height. So again, not ideal, but at this point in time, there was really nothing ideal. So, but she made a pretty good effort there. And then in the middle, you can see her sitting posture and her sitting workstation. On the right picture, we did see a couple people who tried to use treadmills while they worked and so forth. So again, multitasking while they had the opportunity, but us responding with, do some work and then exercise independent of that, because there are both safety trade-offs with that, and then some issues with divided attention and so forth. And you can see, it looks like she has a great view, but, not always the best scenario to have that much light coming in behind. So when looking at these assessments, particular just to these pictures of what we saw, again, common themes, monitors, a lot of monitors being very low was incredibly common. And that was very much due to, as Kermit said early on, the large majority of people only being sent home with a laptop, and many of them solely utilizing that laptop not only for their monitor, but for their keyboard and their mouse. So not having that opportunity to use a split monitor with an external keyboard and mouse. And then again, partnered with that high level of use of laptops, choosing not to, either not having brought it home, not having purchased it, or not already having it at home, an external keyboard and mouse, to, again, where not only to split that from the monitor to allow the monitor to get at a better height and location, but also laptops are traditionally a much smaller keyboard than a normal one, and the touchpad is located right in the middle instead of where you can locate a mouse more off to either the right or left in a more neutral arm and shoulder posture. So those were the two main things. And again, as I pointed out, due to the fact that a lot of people were using a kitchen table, a counter, anything like that, even some of the traditional desks that they have at home, lots of hard edges and opportunities for compression of the wrist due to those sharp surfaces. So that was a very consistent finding as well. And again, as you could see in the pictures, many poor chair choices. And then again, looking at that whole system of the chair might be decent, but due to maybe the work surface location or height or inadjustability or something like that, they couldn't utilize the features of a chair if they did have a good one. So really trying to point out, again, these different areas where they had issues or we had concerns, offer them opportunities of how to fix them, and then really trying to work with them to drive home the point that this needs to be looked at from a systems approach and not just an individual component approach. So looking at how one impacts the other. All right, back to Kermit.
So how can we help? I know Susan has touched on several of these items during the previous slides, but really to hammer home some of them. First, for chairs that do not have any type of lumbar support, you can often use a pillow or a rolled up towel. You can also use them to a towel rolled up to give height to non-adjustable armrests by putting a towel over them or rolling it up. You can even roll up a towel around the entire armrest and use tape to tape it on. so it can be held on better. This is just showing the upper right one, just kind of showing you an option for using just a fluffy towel in the positions to get your arms above the front edge is the key. So you don't want to have your front edges like you have, and you really want to use your arms on the armrests to be supported, because if you don't, you tend to have static postures and of the upper back and neck that contributes to muscular contractions up there that are static, and have to support, your upper body has to support those arms if they're not supported. So you want to make sure that those are taken care of by using an adjustable armrest that is slightly above that front edge, so that you're not resting your wrist on the front edge that oftentimes has a hard edge to it. Next. In addition, what we talked about here is, many people having low screens. The problem with laptops, and I'll talk about that in a minute. Actually, I won't talk about it now. I'll move it forward. We'll talk about that. But you can use books, boxes to stack the monitors up. You can go and get a fancy type of riser for the monitors. But simple stacking of books and or using of boxes or blocks of wood can raise up the monitor to the right height. So you want the top of the screen at eye height. So you're looking slightly down when you're looking at the middle of the screen. Particularly when you're using two screens, you always want to have the primary one directly in front of you. So you're not going to be going back and forth or turning to one side, twisting your neck. So you don't want to have the split screen right down the middle. You always want to have one screen that's the primary one and the secondary one off to the side. Go ahead. Other interventions, we can't stress enough that 30 minutes is about as long as you should be working at any given time. And so you can have a poor workstation, but if you get up every 30 minutes to take breaks, you'll have significant improvements in discomfort. I think this is the number one thing if you can come out of this talk would be to take breaks routinely. Again, two monitors, place primarily one is directly in front of you, the other one should be the side. Sharp edges, you could use a soft towel or even like we're showing here, a piece of pipe insulation or a pool noodle can be on that front edge. And if you're not touching the ground with your feet, if you're on the shorter side, that the chair has got to be adjusted to the workstation and you're not touching, you might be looking for some type of footrest, either a box, a block of wood, even a concrete block can be there nicely. So it can be very inexpensive to raise your, having your foot off the ground and being supported. Next. So what is wrong with the laptops? You have a built-in monitor, which then is when it's put on your lap, it causes your neck to be bent forward because the screen's too low. It's a smaller keyboard, so that creates awkward postures, and the built-in mouse oftentimes is directly in front and often has much more detailed, small, rapid movements than what you have with the normal mouse. So we highly recommend to get an external monitor as well as external keyboard and mouse to use that. You can also use the laptop on books or some type of raising material to get up to eye level and use an external keyboard and mouse to get in proper position. So you can get a very inexpensive way to increase the height of that monitor just by putting it up on books or some box or something that's it gets it up to more eye level, and you use the external mouse and keyboard to get in a better posture when you're typing and clicking to move the mouse around. Go ahead. So basically the take-home message is, traditional desks are what you should be striving home. Set out an area in your home. Obviously, if space is limited, you want to make sure that you're using an external keyboard and external monitor and external laptop mouse when you're using the laptops. But so you don't want to be ever working on couches or beds. That's a definite thing that you don't want to be doing, especially more than 30 minutes at a time type of thing. Makeshift desks often result in poor ergonomics as well, and that turns into elevated discomfort. Companies and institutions, need to think about this as an office in their workplace. And so when people are sent home and working from home, you need to make sure that they're provided with proper training, ergonomics training, as well as allow for proper office equipment to be taken home. So don't just send them home with a laptop. Provide them with an office chair at the very minimum, keyboard, a mouse, an external monitor if possible, but you can certainly get around with those. But you need to make sure that they're adequately equipped at home as they would be in the office. This is certainly an issue. So next. Just want to thank our other contributors, our student team, Thomas Girding, Megan Sick, Denise Danielle, and Jennifer Naylor, and a couple other researchers, Gordon Gillespie, Andrew Freeman, and Tom Houston, that also participate in some of this research. Next. We also want to provide thanks for the support from NIOSH, National Institute for Occupational Safety and Health, through our Education Research Center, and a personal agreement that I'm working with NIOSH to disseminate a lot of this information. I think we have time for questions.
Thank you so much, Kermit and Susan. I know that as being part of CRE-MSD's team, I think I'm on top of all the ergonomics related to safely and healthy sitting, but I've learned a few additional things today, so this has been extremely useful. We've got quite a few questions, so I'm going to just start providing you with these questions, Susan and Kermit, and you can decide who's best to answer it, or potentially both of you. So the first one we had was, you had people using a stylus as an input device. Do you have any insights on that, the type of work or the kind of stylus?
So I can take the first stab at that, and I would say we don't know a lot about the type of stylus. We just had a question whether they used that, so we don't have specifics of the types. I can only sort of hypothesize what type of work. I think, given it's a laptop, I think that in having a touch screen so you can input, so it could have been, and we'd have to probably go look into, maybe it's more of the professors that are doing note taking in that versus more office type of work that would be in there. But that would only be a hypothesis I have. What do you think, Susan?
I agree, just having seen kind of what goes on in my own area, professors annotating notes, drawing diagrams, and so forth for, various illustrative purposes for lectures and things like that. But again, I'll just comment, I know there's lots of questions, and Kermit and I also, there were a lot more things that we were interested in knowing too. And we spent a lot of time on this survey trying to figure out how much can we ask within reason, what kind of information can we get without this being a super long survey, since it was totally voluntary and uncompensated. So we wanted to get a fair, as much information as we could, without having so many questions that people did not complete the survey in a time where a lot was going on and, it was a high stress situation. So it was a careful balance, but there were a lot more things we wanted to know as well. All right, next question.
Thanks for that, Susan. Interesting question about big screen TVs have come up, a couple of them. If you need several screens, can a big screen TV be used as a monitor?
Potentially. I don't think we saw any instances of that. I'm imagining the scenario where it would be wall mounted, and in that situation, it would probably not be the correct height. If it's still if it's still kind of surface mounted, potentially. And then we would go with our traditional recommendation where if you're utilizing two monitors and one is used primarily, that one would go directly in front of you. Then the secondary monitor would go off to the left or right, depending on which way you're more comfortable turning your head, with both of them being at about the same height. If they're equally used, then what we recommend is that when you put the two monitors together, that middle edge is directly in front of you, so you're looking left and right about equally. And then beyond two, if you get into three, you're looking at one in front of you and then one on each side and so forth. And beyond that, it gets pretty kind of specialized, and we're really going to look at why do they truly need that many and so forth, and then how kind of the order of which one's being utilized most, and then working from there. But it's possible to use, utilize something useful like that. It would be an interesting situation.
So I would add to that I think any big type of TV one, it's all about how the person's interacting with that. You're going to have to look at how the ergonomics works out on that. I mean, we haven't done enough research on how that impacts, because really nobody's gone home to have that. But I mean, it's a possibility that you could use that, but I wouldn't necessarily recommend it.
Right.
I don't know if you can get in a good position to do it. So.
Thank you for that, both of you. Now that some of these laptops can increase the angle between the keyboard and the monitor to greater than 90 degrees, sorry, is there a benefit to positioning the laptop monitor flattened, almost in the book position?
I'll take the first stab at it. I would recommend that it's not better, because you're going to probably put yourself in a more flexed neck position, because it's going to be flatter into your lap. The whole problem with laptops is that they're on your lap and that you're already looking way down. Putting it flatter into that, I don't see necessarily how that would improve the situation.
Yeah, I would agree. I think not only neck flexion, but possibly then even having more of that trunk flexion to even bend farther over. And I think the other issue that could arise would be the potential for more glare. As the flatter you get, and the more that's going to be directly below an overhead light source there. So I think still sticking with that recommendation that you go with an external monitor when possible.
Thank you. Now, some interesting questions related to the impact for the University of Cincinnati on this project. Was there any change in policy as a result of your April survey? And has there been an increase in support to provide staff with additional equipment?
So this was presented to higher level administration in terms of what we found and, percentages that we were seeing with each situation. And they did recognize the importance of looking at these work from home scenarios, not only now, but I think various colleges, as I'm sure a lot of the places have, long-standing traditional fully online programs. So we've had people working remotely from the beginning, not just due to COVID-19. So looking at what do we need to do to support them? So there's been some discussion with them about, what should we do? What could we do? It hasn't gotten to a formal policy change yet. I think we're still dealing a lot with COVID. We're still in the middle of it, but we'll continue to work with them, to do this. But we did have that opportunity to present with them, and they did recognize the importance of the findings.
I also provided all faculty and staff was sent out sort of a summary of the things that you could do at home. And then it really broke down to the individual departments on what they wanted to allow their faculty and staff. We provided information to them, but some were more worried about how do we track the equipment than actually reporting on this or doing it. So
right. And we were, in addition, able to do a kind of good office ergonomics presentation that was open to the entire university as well.
Thank you. And I think you've answered the next question. Because this was an anonymous survey, the question was related if there was any follow-up conducted with employees who took the offer for ergonomic assessment and presented you with their pictures. But if it was an anonymous, I think more your education was how you provided support to them. Is that correct?
Well, so with
go ahead.
I guess I was going to start with the pictures. That became not anonymous anymore because they had to give us an email and they sent us the pictures, and then we sent back a report to them to make changes. And I got very positive feedback from almost all of them saying, yeah, I'm going to try to make some changes and do all this. We didn't really go necessarily back to verify that everything was done, but I have gotten several people that sent me pictures afterwards showing what they had done. So anecdotally, we do have some that they actually took us up on making those changes. But it also led to creating a document that we sent out to everybody to recommend, broadly, things that could be done relatively inexpensive.
Yeah.
That's
so
a
it
great
wasn't
service. I just wanted to ask you, Kermit and Susan, what was the percentage of people that actually took you up on that opportunity?
Oh, percentage wise, we only ended up having about 80 that did. So
not quite 10% of the first group.
Okay.
Yeah.
Right. Do you know if the surveyed discomfort level is different from pre-COVID in any way?
We went back and forth on how to ask that discomfort question, whether it was current discomfort or whether it was relative to pre-COVID. Not knowing when we did that first survey if we were going to be able to get a follow-up, and opted to just do it as a current point in time and not relative to pre-COVID. So we don't specifically have that, but we did opt to ask those additional questions on stress and how tired did they feel relative to pre-COVID. There was one general question about discomfort compared to their current office, but the one that was more specific relative to the body regions, no, was just at that current point.
And quite a few questions here around impact of your results. Do you think it's possible to enact work regulations to have 2-minute breaks every 30 minutes in the near future? And is there any work being done in this direction? Likewise, there was a question around, is there going to be any support to provide equipment to those who need it as a result of this study?
So I think that's a very complex one. So the first one, I think with regulations of that, I doubt we'll have anybody that will actually go out and do regulations. I think the science is starting to show that routine breaks do have a major impact, and I think that's going to have to be more of a company by company type of thing. I think with regulations and that, obviously in the United States, ergonomics has been beaten down for quite some time, since 2020 or 2000, almost 20 years ago, and they continue to do that. So I don't know if any type of that, but I ultimately think where this will go is as more people are staying at home and working from home. I think that many regulations will start going there, because you're going to start seeing people having issues at home because they're not set up properly, and it's the company that has to come in and make sure that they're safe. And if you're working from home now, that's going to have to be, obviously it's a big issue potentially for financially, because you now have to have, especially if you're doing it hybrid. Hybrid's a very expensive way of doing it, because you're going to have to make sure that they are safe at home as well as in the workplace. And unless you're going to, in the workplace, have shared workstations, it's going to be very expensive. I think ultimately you're going to have to, make sure that these people are working safe at home. Otherwise, you're going to see people starting having the long-term issues that you generally have with the office, the neck problems, the back problems, and that. So.
I'll speak to the second part in terms of resources. So our university did release some COVID money, where to the individual colleges, and it was kind of left to their discretion as to how they utilize that. So it spanned the whole gamut, but it did come up of whether or not they could utilize it for some office related equipment for faculty. And again, it was left up to the college's discretion. So some opportunity there. In the long run, we'll see what happens.
Well, I want to thank Susan and Kermit so much for this really detailed presentation, and to encourage our participants today to come back and join us on Friday, October the 15th, where we will have the second in 4 webinars of the series, and it is about working from home and beyond, looking at addressing technology, ergonomic, and organizational factors. And coupled with that, CRE-MSD will be putting out a survey in the near future to look at some of these issues related to organizational support and what is happening largely across Ontario. So thank you so much. If you have questions that you don't feel got answered or something occurs to you, please send directly an email to Susan or Kermit. They've provided you with their email information. And or of course, you're always welcome to email Bettina and I at CRE-MSD. Thank you very much for joining us today, and we look forward to hearing from you when you get our evaluation.
Thank you for the opportunity. We appreciate it. And again, yes, we would be happy to entertain any questions or comments that we didn't get to in the chat.
Have a great rest of the day, everyone. Thank you.